Welcome to our comprehensive guide on POEM, a cutting-edge procedure for treating achalasia in children. Our team at Children's National Hospital is dedicated to providing the highest standard of care with innovative and less invasive options. What exactly is achalasia? It's a rare disorder where the muscles in the esophagus fail to properly relax, making it tough for food to pass into the stomach. Symptoms can range from swallowing difficulties to severe chest pain. We categorize achalasia into 3 types based on how the esophagus behaves. Type 1 achalasia is sometimes called classic achalasia. With this type, the esophagus muscles barely contract, so food moves down because of gravity alone. Lower esophageal sphincter does not relax and open. In type 2, achalasia pressure builds up in the esophagus, causing it to become compressed. This is the most common type of achalasia, and it often causes more severe symptoms than type 1. There is no peristalsis. Rather, there are intermittent periods of compartmentalized esophageal pressurization. Lower esophageal sphincter does not relax. Type 3 achalasia, also called spastic, where abnormal contractions at the bottom of the esophagus where it meets the stomach. This is the most severe type of achalasia. The contractions can cause chest pain that can awaken a person from sleep and imitate the symptoms of a heart attack. Each type requires a specific approach, ensuring that our treatments are tailored to provide the best possible outcomes for our young patients. Diagnosing achalasia involves several key tests: a barium swallow, upper endoscopy, manometry, and the innovative endo-flip. These tests help us understand the functioning of the esophagus and plan the most effective treatment. POEM, or peroral endoscopic myotomy, is a minimally invasive procedure. The procedure begins by inserting endoscope through the mouth into the stomach. An incision is made in the lining of the esophagus using a special knife on the tip of the endoscope. Our surgeon tunnels through the wall of the esophagus. This will allow our surgeons to access the muscle layers below to perform the myotomy. Surgeon uses the knife on the endoscope to create an incision in the inner muscle layer along the lower portion of the esophagus, the lower esophageal sphincter, and the upper part of the stomach. The precise cutting of the inner muscle layer relieves the tightness of the sphincter and allows a more natural passage of food from the esophagus to the stomach. After the myotomy is performed, the doctor closes the incision in the lining of the esophagus and the endoscope is removed. Preparing for the POEM procedure is straightforward. Your child will need to follow specific dietary guidelines and take prescribed medications to reduce infection risks, ensuring they're fully prepared for surgery day. Post-surgery care is crucial for a smooth recovery. Initially, your child will be on a liquid diet, gradually moving to pureed foods. We monitor their progress closely to manage any discomfort and prevent complications like strictures or reflux. Here at Children's National, our commitment to your child's health continues well beyond the operating room. Follow-up appointments via telemedicine ensure we're always accessible for guidance and to monitor recovery, aiming for a successful return to everyday life. If you have any questions or would like to inquire about our amazing program, please email us at tf@childrensnational.org or call 202-476-2151.